Hi, I'm Dr. Marty Bergman, and I'm here in Maui at the RWCS meeting. Yesterday I gave a lecture on meta-analysis and how to interpret it. I think it's important for us when we look at meta-analysis to go beyond simply looking at the title and the conclusion, because what goes into the meta-analysis is just as important as what comes out. Meta-analysis at its best can be the pinnacle, can be the best of all studies, but if done improperly, it can truly be garbage in, garbage out. The best way to look at it is to really look at the components. You have to see what was done, how they picked the different articles, the different journals. Did they look for biases? How did they combine the studies? And then how did they finally interpret the studies? And if you don't look at each of those components, or if each of the components aren't present, then you're wasting your time looking at them. These are really complex studies that have a lot of potential of being beneficial, but a lot of problems with being fraught with biases and problems. You start by looking at how they picked the journals, how they did it. There should be a systemic review, and they should tell you how they did it and what their biases were there biases. You have to look at whether or not the journals and the articles that they picked, were those studies, should they have been combined? And there's something called heterogeneity, which is a measure of how different they are. If the heterogeneity is way too high, either they shouldn't be combined or you could separate out. When you look at it, check to see the weighting. Look to see whether or not one study drove the entire result, or was it truly a meta-analysis of multiple results. And when you finally look at it, check the confidence intervals. Make sure your confidence intervals for the final result doesn't cross the 1, or the unitary, or the midline. If it touches or goes over that midline, you've shown no difference between the therapies that you've been trying to look at. So again, meta-analysis, beautiful work. It's wonderful studies. It can be the absolute pinnacle of studies. It can give us information and ability to combine different studies together that ordinarily wouldn't have given us the results, but at the same time, when done poorly, it truly is garbage in, garbage out.